Hello, everyone, and welcome to another episode of Protecting the Vision, sponsored by the National Optometric Foundation. My name is Dr. Timothy Brown. I am a board member for the National Optometric Foundation, and I'm so excited to be on with this webinar tonight. Got a great guest speaker who I'll introduce later on the show. Just want to tell you a little bit about the foundation. So for those of you who are joining us for the first time, we are a nonprofit organization. We support the National Optometric Association, our parent company, in various ways. We partner with them to provide free eye exams annually at the National Optometric Association Convention. There's one coming up in July in Ohio. We will be in Ohio this year. And doctors and technicians, some of our business partners, sponsors come alongside with us, students also, and we provide service, care, eye exams for the community that we're in. We're trying to serve underrepresented, underserved communities around the USA. So wherever the NOA conference is, we are there to be of service and provide these free eye exams and recommend that they will go to a clinic if we find something that needs further attention. We also provide free glasses on that day for most of the people who are there. VSP partners with us and they bring out their mobile lab and provide glasses for people that same day based on the prescription that the doctor finds at the eye exam on that day. We also support students who are thinking about going to optometry school, those who are in optometry school. We support them with scholarships thanks to the people who continue to donate and allow us to be able to do the great things that we do as the foundation, supporting students, supporting communities, trying to educate communities, churches, sororities, fraternities, organizations, whatever it may be. We're trying to educate the community, and one of the ways that we're trying to do that as well is through these webinars. And I'm so thankful for all of our great speakers who have been on previous webinars that we've been doing over the past 2 to 3 years on the third Monday at 7 o'clock. So the foundation also would like for you to know that we want to highlight the 3 silent killers of your vision when it comes to something that can slowly start to take away your vision and you may not have any symptoms or you don't have any symptoms of it. They're hypertensive retinopathy, glaucoma, and diabetic retinopathy. We've had speakers to speak on these topics in previous webinars, so be sure to find that topic, share it with the family and friend so that they too can find the education that we're providing here on these webinars. And so tonight we have a great guest speaker. This guest speaker is Dr. Jasmine Mitchell. She is dedicated optometrist originally from Lafayette, Louisiana area, and she earned her undergraduate degree in biology with a minor in chemistry from the University of Louisiana at Lafayette, graduated magna cum laude. She went on to receive her Doctor of Optometry degree from the University of Houston College of Optometry, where she also graduated magna cum laude. Dr. Mitchell recently relocated to the Washington, D.C. area and will soon begin practicing at a collaborative OD-MD clinic in Southern Maryland. So she's going to be at a clinic with optometrists and ophthalmologists there. So they're going to be able to do a lot more service to help the patients at that type of clinic. She's a proud member of Alpha Kappa Alpha Sorority Incorporated and is passionate about providing quality, compassionate eye care while making a meaningful impact in the community. Thank you, Dr. Mitchell. Outside of her professional work, Dr. Mitchell enjoys spending time with family and friends and trying out new restaurants. Now, that's where we can partner with there. Finding food, good food, Dr. Mitchell, that's my thing. So Dr. Mitchell, I want to go ahead and welcome you onto the show. Thank you so much for your time and the wisdom that you are going to share with our listening audience tonight. We do appreciate it. welcome to the show, Dr. Jasmine Mitchell. Everybody, show us some love down in the comments, if you will. Welcome to the show.
Thank you, and thank you so much for having me. I really appreciate this opportunity to share some insight onto, taking care of your eyes and eye health.
Absolutely. And I know that the wisdom and the little nuggets that you're going to drop tonight is going to be so helpful for someone who's either listening now to our live webinar or they may catch it later on our YouTube channel. They'll be able to listen to this webinar and also share this webinar with their family and friends there as well. So thank you so much in advance for all that you have to share with us tonight. And so, and speaking of sharing, I like to just notate that sometimes we see patients, we're in Augusta, Georgia, at Insight Family Eye Care. We see patients who are coming to us and it's their first ever eye exam. Mm-hmm. And sometimes these patients are over the age of 30. Sometimes they're over the age of 40. Mm-hmm. We like to see patients sooner than that, but we also tell them it's better that you're in now versus never at all, because we know that we can sometimes detect things that people may not have symptoms of there. Mm-hmm. But I just want to just say for you, for those out there who may not know, when is an appropriate time for people to see their optometrist? A lot of people don't know when they should go see their optometrist, and that's what we want to talk about tonight. Knowing when it's time to see your optometrist there. So maybe you could start us out there giving them some guidance to when is the time to see their optometrist.
Yes, so it is generally recommended that you go to see your optometrist every 1 to 2 years. And this is because even though you feel like your vision may be stable, you don't need glasses, or, oh, my glasses work just fine, my contact lenses are fine, we still want to see you every 1 to 2 years. Once a year if you have any conditions such as diabetes, high blood pressure, just so we can check up what's going on in the eyes, because you may think that your conditions are controlled. Your doctor may even say like, hey, your numbers are looking fine. But when we look in the back of your eyes, we may see some bleeding. We may see signs that it's not as controlled as you might have thought. And so it's really important that you come to get the checkup once a year. Sometimes, we might say,
And I'm going to let you finish, Dr. Mitchell, but sometimes I tell people this little slogan: don't delay, do it today. If you're listening and you know that you have not had your eye exam, your children have not had an eye exam with an optometrist, not the screenings that they do at the school, not what your P's doctor is doing, but an actual eye exam, comprehensive eye exam with an optometrist like Dr. Mitchell. This is the time to pick up the phone and call and schedule your appointment. So do not delay that. Dr. Mitchell, go ahead and continue.
Exactly, yes. And then as far as, like you said, children during the screenings. So optometrists, there are some optometrists that will see kids as itty bitty as a couple months old. I would definitely recommend letting your kids see an optometrist before they start school, because if they're starting school and they may not be able to see well, that's definitely going to delay their growth. That's going to delay their learning. So you really want to get your kids in to see an optometrist. You yourself see an optometrist. So if you're out and about in the world, it's time to see an optometrist, especially if you haven't gone in the past year or two.
And sometimes, Dr. Mitchell, I'm not sure if I'm cutting you off there. People don't know how to find a doctor. I know that you're going to be in a location where you're going to have optometrists and ophthalmologists soon. Some people may not know how to find an eye doctor, and they may not know the difference between seeing an optometrist versus an ophthalmologist there. So if those two things are something that you are able to share, I want you to just highlight some of those things for those who may be listening, so that they'll know how to find an eye doctor and what's the difference between an ophthalmologist and an optometrist.
Yes. So how to find an optometrist. So it could be something as simple as just going on Google. So you can go on Google and ask optometrist near me, ophthalmologist near me, you'll know the difference between an optometrist and ophthalmologist, and I'll get into the details a little later. But one of the main differences between an optometrist and ophthalmologist when you're on Google is by simply just looking for the end of the name. So for me, it would be Jasmine Mitchell, comma OD, as an optometrist. Ophthalmologists are going to have the MD behind their name. Another way to find a local eye care provider near you, other than going on Google, is asking around, asking your friends, asking your family who they go to. You can also go to your insurance websites. So going on, your insurance website, whether it's a vision insurance or healthcare insurance, and seeing like which providers are on your insurance can also be a way to find a provider. And then another way that you can find a provider that not many people think about is by going to the local society's websites. So for me, I'm in Maryland. The local society would be the Association for Maryland Optometrists. And so if you go on that website, you can find optometrists who are active in their profession, active in the community. You can go to other society websites and just look for optometrists on that website to find an optometrist near you that you can go to for care. And then also you may go to an optometrist, but you may have a special concern or condition such as dry eyes. And there are certain optometrists who really focus on dry eyes, or if you have a small person in your home, a little bitty, as I like to call them in the office, you may want to go to an optometrist that specializes in pediatric care. And that is something that you can also find just like by simply Googling it or going to, like I said, different association websites. So Googling optometrist that specializes in pediatric care or going to the different association websites. And lastly, one of the things that I would say is that optometrists, we're really a close-knit group. And you may call the office and be like, I have a patient, I have a child that is 5 years old, I want to get them seen. Do you see kids? That office may say, no, we do not see 5-year-olds. However, I do know an office that does see 5-year-olds. Or you may be interested in specialty contact lenses, and they'll be like, I don't do specialty contact lenses, but I know someone who will. I'm saying all this to say that there are optometrists all around you. Sometimes you may just have to look harder, but don't be afraid to call around, shop around to find an optometrist that best fits your interest. Going back into the difference between optometrist and ophthalmologist. So like I said a little earlier, optometrists are going to have that OD behind their name. Ophthalmologists are going to have the MD behind their name. Another one of the big difference between optometrists and ophthalmologists are medical doctors who went to school to become eye surgeons. Optometrists have a doctorate in optometry, and we focus on the visual pathway, treating and diagnosing ocular conditions. Ophthalmologists do that as well. Optometrists also prescribe glasses and contact lenses. Ophthalmologists can do that too. And we also, optometrists can do certain laser procedures depending on what state we're in, as well as minor procedures like removing small lumps and bumps around the eyes. So which is which and when should you go? So optometrists are going to be your primary care providers of the eye. So we are the providers who you go to, for your comprehensive eye exams, your once-a-year exams. If you have dry eyes, itchy eyes, red eyes, you come to us. Ophthalmologists specialize in specific areas, whether it's the front of the eye, the back of the eye. They're going to be the people you go to for cataract surgery. If you're having bleeding in the back of the eye and you need injections, if you need a more invasive surgery, that's where you would go. Optometrists and ophthalmologists do work together. So I'm going to be in a clinic with an ophthalmologist, and we collaborate all of the time. I send patients to them, they send patients to me. So it is a collaborative effort in order to take care of your eyes and make sure that your eye health is in the best shape that it could possibly be in. And another way that I like to just compare the two is if you have an itchy throat, the first place you're going to go to is probably your family doctor, your internal medicine doctor, your primary care provider. You're not going to go straight to an ENT doctor. So a doctor that specializes in the ears, nose, and throat. You're not going to go there first. You're going to go to your primary care doctor first. And that's the same thing with optometrists and ophthalmologists. Usually you start off at an optometrist's office, and if it gets to the point where you do need that invasive surgery or you do need a little bit more specialized care, that's when we would transfer you over to ophthalmologists. And most of the time you work your way back to us. So that's the main difference between optometry and ophthalmologist. And you may be wondering concerning your, you're back.
Yes, and you did a great job telling the difference between optometrists and ophthalmologists. And it's good for people to know that we work together as a team to help take care of you. We work with your primary care doctor. We work with other ophthalmologists or specialists there, glaucoma specialists, corneal specialists, retinal specialists, all for providing the best care for the patient. So those of you who may be listening, if you didn't know the difference between an OD, an MD, optometrist versus an ophthalmologist, Dr. Mitchell just laid it out very simple there for you. We know that sometimes you all may not know what we know and you have questions. We want you to feel comfortable asking questions, not only on this webinar, but also to your eye doctor that you go to. Take your questions in there with you. And if you're still shy, just have them written down and pass it on to the doctor. We are here for you. So we want you to ask questions, and perhaps you need to bring someone with you who can advocate for you as well when you go to see your optometrist. So thank you, Dr. Mitchell, for making that clear. One of the other things, because I heard you mention dry eye. Sometimes people come in to get a prescription for glasses. They get a prescription for contacts. And then on top of that, they start talking about scratchy eyes, itchy eyes, dry eyes. Does that all fall under my iMed vision insurance, my VSP insurance, or my Spectera or Davis Vision plan? I got a health plan as well. When do I know to use my health insurance versus my vision insurance, when I come to see you all for my eye exam?
So that's a great question, because it is very confusing, because you would think vision insurance means anything with the eyes. So I'm at the eye doctor, I'm using my vision insurance, whether that's for dry eyes, itchy eyes, glaucoma, glasses, but that's just not the case. So your vision insurance is going to cover your comprehensive eye exam, it's going to cover the glasses, it's going to cover the contacts, sometimes, not all the time. It may not cover the full amount. If you're given those expensive lenses with all the bells and whistles and the really nice frames, your vision insurance might cover part of that, but it might not cover the full amount. But that's usually what your vision insurance is going to be for. Your medical insurance, that's going to be your dry eyes, your itchy eyes, your red eyes. Anything that's not, I'm here for my annual eye exam to get glasses, contact lenses, it's probably going to fall under your medical exam. And I know that can be frustrating, especially if you're thinking about using your vision insurance at the exam, and then we're telling you, oh, we got to switch this out, or we need you to come back for this other complaint, this dry eye, this itchy eyes, because this is just a comprehensive exam. It's not because we just want you to just keep coming back to see us. We do want you to keep coming back to see us. Don't get it twisted. We want you to come back to see us, but we're not dragging you into the office just so we could use up your insurance. We can't use the different insurances on the same day either. So if you come in one day for vision, then use your vision insurance. We can't also use your medical insurance at that same visit. So we have to split up the exams, and we have to use it for different things.
That's right. They will require that you come back. I know I was working at a medical optometrist office, and we would do a lot of glaucoma. We would see a lot of glaucoma patients, and you want to do, photos and the OCT, because you want to try to get as much information for the patient while they're there. But the insurance will require that they come back on a different day to do those other testing and everything under their medical plan there. So you're absolutely right. There's a limit, but your medical health insurance, if your optometrist is contracted with that health insurance, they can use that health insurance to help cover some of the costs. Like you said, not everything is covered when you do your nice frame, and you're getting the blue light AR coating on it, and you're getting transitions on your lenses. You're going with polycarbonate or high index lenses. Those things comes with a copay based on, and these are things that your insurance tell the optometrist who's contracted with them to collect from you as the patient there. So when you come in, just know that, and you have a right to see a copy of it so that you can understand, about the financial side as well there. And then, Doc, we were talking about medical. So when they come in, because we know that there are some things that we can detect that they may not have a symptom of, and we need to see more into the back of their eye, towards the retina, the back of your eye. Patients don't know when should they be dilated, and if I get dilated, for this comprehensive eye exam that you all are providing, do I need a driver to come with me? Will I still be able to drive? Can I read? Will I be able to make it home? Can you talk to them a little bit about that?
Yes, of course. So when do we want you to be dilated? So we usually say, again, every 1 to 2 years. Now, if you're healthy, you're young, you don't have any systemic conditions, it may let you push it back a little bit for 2 years. But most of the time, we want you to get dilated once a year. And again, it's because I like to think preventative care is the best care. I'd rather catch something early on in its disease process than 2-3 years down the line when we have a whole commotion going on in the back of the eyes. Now, if you go to certain clinics, there are cameras that can take pictures of the back of the eye that that some people say can replace dilation. However, I like to think of the camera just as like you would think of a normal camera. Yes, the camera can take a picture of the back of the eye, just like you can right now take a picture of the room you're in. However, that picture won't be 3D. You won't be able to tell exactly how far away something is or how close something is. If it's actually, is it floating in free space, or is it kind of all the way to the back of the eye? You also don't get the full image of the back of the eye. So the camera cannot fully see the back of the eye like we can when we dilate you. And so even though that can be an alternative sometimes, we don't want that to always be the go-to. We don't want you to automatically always go for the camera. Not to mention the fact that at some offices, depending on where you go, the camera will be an extra charge. So I would say, you definitely want to get dilated once a year, if not once a year, twice a year. Now, whether or not you need a driver honestly depends on you. So if you've gone to the optometrist a few times, you're a pro at going to the eye doctor. You have glasses. You're seeing pretty well. You're seeing, the 20/20 or the 20/30 when you come in. You have your glasses on. You get dilated, and you feel comfortable driving after, the sun doesn't bother you, then I would say you may not need a driver. However, if you've never been dilated before, you don't really know how it's going to affect you. Or, if you're already feeling like your vision's a little hazy, it's a little rocky, I would definitely say to bring a driver with you. They don't even have to stay for the full exam. So you may want to have a driver just drop you off and then go off, run errands, and then pick you up a little later. You can let them know that, hey, dilation can take anywhere from 10 to 30 plus minutes. So it's going to be a longer exam. So you can go run errands, come pick me back up when you're done. Also, if like thinking about whether or not you're going to be able to read after. So when we dilate your eyes, it does do something to the focusing system of your eyes that will give it a little trouble focusing up close, just like you have a focusing option in a camera, you have a focusing equipment, I call it equipment, in your eyes that allow you to see up close. So that's gonna be an issue for a couple hours after dilation. It will reverse after a few hours. However, I will say not many people, but every now and then you can have a bad reaction to dilation with like headaches, nausea. If that occurs, we definitely recommend that you call the office sooner rather than later. Let us know what's going on. We might tell you to come back in to check up on you. But to summarize, yes, you do need to be dilated once a year, if not once a year, twice a year. Do you need a driver? It depends. If you're used to getting dilated and you know that you're good to go once you're dilated, maybe not. But if you've never been dilated, or the last time I got dilated, I couldn't see, please bring a driver. We want you to be safe on the road. We don't want any accidents. If you need to stay at the office for a while and you want to help us out with paperwork or sort the waiting room, we'll let you do that too until the dilation wears off. But yes.
We'll take all the extra help that we can get in the office, right, Doc?
Yes.
Yes, and you hit some really good points there. Dilation, yes. Driver, we want you to be safe, so always make the right choices. Someone's available, bring them along with you and let them drive for you, as Doc was just saying there. And then you also said, so you're saying frequent headaches can sometimes mean that I may have vision problems because, my primary care doctor, my primary care provider, PCP, may refer me to an optometrist. If they refer me to an optometrist, some patients, I'm talking as if I'm the patient, should I go to that appointment there because I'm having headaches?
Yes. So how I like to think about it is sometimes headaches can be caused by eye strain, whether that's, the glasses are too strong, the glasses aren't strong enough, you don't have glasses, or maybe your eyes aren't aligned the way they need to be aligned. And so most of the time when your PCP is referring you to see an optometrist due to headaches, they want to kind of figure out the small problem. Because if it's just an issue that could be fixed with glasses or maybe vision therapy to help align your eyes or special glasses to help align your eyes, we want to do that before we start shipping you off to get poked and prodded and blood work and go to a neurologist for headaches. And so should you go 100%, please come see us. We are probably some of the most friendliest doctors you'll ever meet. Come have a seat. We'll figure out if your headaches are caused by an eye issue, and if it is, we'll try to figure it out for you. If it's not caused by an eye issue, we will collaborate with your primary care provider so that they can get you down to the next step or the next specialist to help you out with that.
Right. And Dr. Mitchell, not to interrupt you there, but many times patients are not quite sure when they're going to see an optometrist for their eye exam, what should they bring? Do you have a short list of things that you recommend that they bring to that exam? Because like I said, sometimes we're having people come for the first time. They've never been to an eye doctor before. So I just want them to be as prepared as possible through this webinar. So can you help us with that as well?
Yes, of course. So what to bring to an eye exam. So before I was a doctor, I worked and shadowed in a bunch of different clinics, and I would always have patients come up to me and not know what to bring, or we would get into the room and we would start, care, and we were missing a couple items. So I feel like this list is a good list to start. So one of the things that I say to bring are your eyeglasses. I know sometimes you may feel, well, my eyeglasses don't work well, or I don't like my eyeglasses. They're scratched, they're broken. I don't wear them all the time. Why do I need to bring them? You need to bring them so that we know if you don't like them, what you don't like. You also need to bring them in case, let's say you love your glasses, what you love. Also, sometimes the eyeglasses have special material in those lenses, and you may have special coatings, whether that's anti-scratch, scratch resistance, anti-reflective coatings on your glasses. And it's important for us to know what lenses you're in so that we know, like, okay, if you're doing really well in these lenses, we're not going to switch you out of the specific type of lens that you have in your glasses. We might want to keep you in that. Or if you're having trouble with those lenses, we may want to switch you, but we don't know what to switch you to if we don't know what you're currently in. You do not need to bring the actual prescription you got from another doctor for your eyeglasses. We could usually have the equipment in the office to read the eyeglass prescription. So if you've lost that along the way, that's okay. If you have that, that's more information for us. It's always helpful to bring that. We also suggest that you bring your contact lens info. So it's kind of the same thing with the eyeglasses. If you love your contact lenses, you have them in, that's great, but we don't know what you love. We don't know the power. We don't know the brand. I've spent a lot of time in the exam room just like scrolling through Google Images, trying to find the right box. And we usually always get to the end result. We find it, but it's much easier and it's much more reassuring if you bring that info in. You don't have to always bring the actual box. You could bring a picture of the box, a printed prescription that you may have gotten from another doctor to the office. You could also bring the little blister pack or a picture of the blister pack, just so we know what contact lenses you're in. So again, we know what you love or what you may not love. A list of medications. So we've talked a couple of times throughout this webinar about how when we look at the eyes, we can see different systemic conditions that you may not even know you have. That being said, the medications that you take systemically, so by mouth, maybe injections, whether past or present, can affect the eyes. Sometimes you don't even know that they're affecting your eyes, but it's important for us to know what medications you're on so that we know if we see something in the back of the eye, we could be like, oh, this may be caused to this medication. Or if you're experiencing extra dryness, we could be like, oh, okay, well, it might be due to you taking this medication. So it's just important for us to know what medications you're on. And the easiest way to do that is to just have a list of your medications ready for us. You get bonus points if you could bring a copy just for us to keep so we can scan it, or someone can type it in and then give it back to you later. But if not, just maybe have it, you could have it in your phone, have pictures of the medications you're taking, just something ready for us to have so we could put in our system. Your medical history. Again, a lot of things affect the eyes that we don't even know affect the eyes. So it's important that we have your medical history so we know what conditions you have, what procedures you've had done before. So we know when we look at your eyes, we can attribute certain conditions that you have or certain procedures you've had in the past to what's going on with your eyes. Your whole body is connected to each other. Your eyeballs are not separate. So we need to know what's going on in the full body. Your health insurance card and your vision insurance info. So I like to say always bring both to an exam, because you may think you're going for a comprehensive eye exam, but it may turn into a medical exam. We may need that medical insurance, if not for this visit, for when we have you come back later. And so we really just want you to bring all of that information in with us so that we can have it and we can provide you with the best comprehensive care. So we can not only just take care of your eyes, but make sure everything's working together and working together well.
I love that list. That list is perfect, for any patient going to see their optometrist, whether you're going to see them for the first time or you're going in for the second or third time. Definitely that medication list, Doc, I'm telling you, it makes a big difference when we have a patient that walks in with that list versus one that's walking in without the list and they're just trying to think off the top of their head what they may be on. So thank you for providing that list. That's a great list of things that people should bring. Even your eyeglasses, like she said, even if you don't like them, bring them so we'll know what you do not like. Those things help us out in determining where we're going to go when it comes to your next prescription for glasses there as well. So great list, Doc. Thank you for that. Health insurance cards, medication list there, eyeglasses, all of that are good things there. Now, sometimes we see patients for what we call office visits. These are patients that's coming in with things that's not necessarily going to be taken care of just by doing a refraction, finding out what their prescription is for the glasses. Ocular emergencies, Doc. Can they go to see you? Can they go see an optometrist for these ocular emergencies? Like, and what will you categorize, for ocular emergencies? Can you give us a little insight about that as well?
Yeah, so I usually like to break this down into 3 categories. You have your office visits, your urgent office visits, and your emergencies. So your office visits are going to be things where you schedule an appointment and you get in. Sometimes you need to get in within that week, sometimes a month. Usually I would say the front desk when you call are really, really good at determining like the length of time in which you can be scheduled. So I call these offices visits your red or your pink eyes. So you wake up one morning and your eyes kind of red, it's feeling kind of icky, or your eyes are kind of pink, your itchy eyes. Maybe you wake up, you got a bump on your lid, or your eyes are tearing, they're feeling dry, they're really irritating you. These are going to be your office visits. Depending on how busy the office that you call is, they may be able to get you in that same day. They may be able to get you in within a week. These are the symptoms or the signs that I would say, if they say, hey, we can't get you today, we might be able to get you tomorrow, that's okay. Then you have your urgent office visits. Your urgent office visits are going to be your sudden decrease in vision. Like all of a sudden, something, your vision just automatically decreases. You're feeling like there's something in your eye. You may have a new onset of double vision. So all of a sudden you're seeing double. Your eyelids are swollen. You're feeling like very strong eye pain, very severe eye pain. This is going to be something where you're having a curtain or a veil drop in front of your eyes, or you're having a new increase of flashes and floaters. This is your urgent. Come in sooner rather than later. We want you to see you same day, as soon as possible. Usually when you call the front desk, they're going to fit you into the schedule somehow, some way. If not, they'll refer you to someone who can see you. So these urgent office visits, I like to call them urgent office visits. It's because this is not something that all the time you want to go to necessarily urgent care. The providers at urgent care are amazing, but not all of them have, unless there's an optometrist or ophthalmologist at that urgent care office, they don't normally have the tools to look at the front of the eye or the back of the eye in a way that we can at our office. And so that's why I call it an urgent office visit. It's urgent, but come to the office. Let's look at you. Let's triage you. And if it's something we look at and we're like, oh, wait, this is an emergency, then we could send you, I remember at one clinic, we used to send you with a little piece of paper to the emergency room so they know, hey, this is what this patient has. This is why it's emergent. And you're good to go there. Because if you just go to the emergency room like, hey, my eye's red, I'm telling you right now, if you go to the emergency room and you go in with a red eye at 5 o'clock and someone walks in having a heart attack at 5:30, you're going to be sitting there for a while. And it's better in that case to just call your local optometrist, your ophthalmologist, let them know what's going on, and so they can help you out. So where you're not sitting in an urgent care or the ER room for hours and hours. Now, emergent cases. So emergent cases, this is where I'd say just go straight to the emergency room. And this is going to be if you have something like an open globe injury is what we call it in eye doctor world. But this is if you get like a tree branch stuck in your eye, a needle stuck in your eye, something that's stuck in your eye, is going through the eye. That's when you're going to go straight to the emergency room. I will say this list varies for every doctor. Some doctors may move things over to regular office visits and say this is not as urgent. Some people will move the urgent to the emergent, but it's always important that when you're having eye issues, try to get in contact with your optometrist or your ophthalmologist office first so that they can send you in the right direction, because we don't want you sitting in an urgent care for hours upon hours when it's something that we could have handled in office. Or in the same thing for the emergency room. We don't want you going there, sitting all day, and it was something that we could have taken care of in office. And if we do need to send you that way, we're usually going to give notice to whoever is at the emergency room or the urgent care, like, hey, this is what this patient has. This is what I think should be done, or this is the next steps that I think should be done.
Absolutely. Yeah, I mean, you hit the nail on the head there. It makes a big difference going to the emergency room or urgent care with that note from an optometrist or an ophthalmologist versus just walking in on your own and sitting there, because they're going to base it on priority. Heart attack, stroke about to happen versus red eye, so I'm glad that you mentioned that, because that's important for people to know the difference. And then sometimes what you're going to the emergency room for, you're optometrist or the ophthalmologist, they can take care of it that same day. You won't need to go there. You know, it may not be as serious as you may think, therefore, the emergency room. So, and then sometimes, Doc, you're out of the office, 5 o'clock, you going home, somebody got an emergency. You know, we always say, if this is an emergency, please hang up and dial 911. You know, what are patients to do after 5 when most optometrists are shutting down their office for that day?
Yeah, so that's a great question. So it kind of just depends on the area you're in and your optometrist or ophthalmologist office. So I'm in a clinic to where we have on-call doctors. So if you call us after 5 o'clock, you're going to get connected with someone who's going to connect you to an on-call doctor that will say, hey, yeah, this sounds important. You can come in right now. This sounds urgent. Like, I'm going to see you. Or, hey, this does sound important, but I don't really need to see you today. I'm going to, put in these medications. Take this. I'll see you on Monday. Or, hey, this is important, but I don't need to give you anything, and I don't need to see you this weekend. I'll see you on Monday. And then if your optometrist does not have an on-call solution, usually, well, I'm not going to say usually, another option is that they might just have a triage nurse or a triage tech that they're not an on-call doctor, but they're still on call, to where they'll kind of guide you into which direction you need to go to. Now, if none of those are true, then that's when you might want to start thinking about going to the urgent care or going to the ER. I will say again, it's important to remember that if you're sitting there with a red eye, you're going to be sitting there for a while in that emergency room. And depending on how big of a city you live in, not all hospitals are going to have an optometrist or an ophthalmologist on call to come in and see you. And so if it's not an emergent condition like we were talking about earlier, sometimes you might need to wait till the next morning or wait till Monday morning. Now, if it's under that urgent category that we talked about, or the emergent category, yes, go if it's after 5 o'clock. But try calling that local office first and see if you can find an on-call doctor, and make going to the urgent care and the emergency room for like a red eye, a pink eye, kind of like the last resort on your list. And then also, depending on where you live, there are certain optometrist office and ophthalmologist office that are open on the weekends. So, maybe sometimes you do have to stray away from your main optometrist, your main ophthalmologist, and go see another doc. The main importance here is that you get the care you need in a timely manner. So first, try for that on-call doc, try for that on-call tech, try to get triage to get seen. If not, try to find an eye care provider that is open. And if not, and you're experiencing severe eye pain, you're experiencing, you get something in your eye, like something penetrating into the eye, then that's when you would, and if it's after 5 o'clock or it's, that Saturday, that Sunday, and there's no one open, that's when you may want to start looking towards that urgent or emergent care. But don't make that your first stop.
Thank you. Thank you for explaining that, your experience, the environment that you're in, the type of clinic that you're in allows you to be able to share wisdom that other optometrists may not be able to give some insights to. Mm-hmm. So that's why I love these webinars, because every guest speaker is unique in their own way. You all bring something to the table to share with our listening audience there. And as we've been listening to you, Dr. Mitchell, we are learning that 2020 goes beyond, great vision goes beyond 2020. That's what Dr. Brown often say, Dr. Sharita Brown often say there, because there can be other things going on that can stop you from being able to have that great vision there. So as we're listening to you, we're learning that optometrists, ophthalmologists, they can detect health issues that's beyond, just having a vision problem where you need glasses or you need contacts to be able to help out there. Do you see children as well? What age do you think, someone listening, they got a child, what's an appropriate time for them to take this as we're wrapping this up to see an optometrist?
I think that a good age would be before they start school. So around that 4-year-old mark, I would say take your kids to the optometrist office so you know what their visual needs will be when they start school. However, if you notice your child is having issues seeing, maybe they're squinting, their eyes are tearing, you're noticing an eye turn, that's when you want to definitely bring them in sooner. Some people like seeing the itty bitties a little more than me, and so they would say start bringing your kids in as soon as like a few months old, 6 months to 1 year old. I normally set my age around like 4 and 5 and above. But like I said, there are some optometrists who are more than happy to see your 6 month old, your 1 month olds. But I would definitely say by 4 years old, we need to have that first eye exam.
Excellent, excellent, excellent. Thank you. Thank you so much, Dr. Mitchell. Thank you, Dr. Mitchell, for sharing so much wisdom with us tonight. And wrapping up, if you would like to tell those who may be in your area how they can come see you, you can do so at this time.
Yes, so I will be letting my location known of the location I'll be practicing at very soon. So you can always look me up on Google, Jasmine Mitchell OD, as well as LinkedIn. And then also it's the same thing, as well as on my Instagram, Jas, JAS, I care, EYECARE, no spaces. And I will be uploading the location as well as the practice hours and the days of appointments that are available very soon.
Excellent, excellent, excellent. I want to thank you for being on with us tonight. I hope that you have a great rest of the evening and looking forward to having you on some of our future webinars. I love all the and have a great evening. Thank you so much, Dr. Mitchell, for being on the webinar as our guest speaker tonight.
Thank you for having me. Thank you.
And thank you guys for tuning in for another episode of Protecting the Vision. I'm not in my usual area today due to personal issues that's going on there. So if there was any technical difficulties, I apologize. My name is Dr. Timothy Brown, board member for the National Optometric Foundation. Look us up. We have a Facebook page that you can connect with. We also have a website if you want to learn more about our foundation. And if you would like to contribute, we also have Cash App, $ Protecting the Vision, where you can donate tonight to help us continue to do the great things that we're doing for the communities and also for our students and being a partner with the National Optometric Association. We're looking forward to seeing you all on our next webinar. And we're also looking forward to seeing some of you as eye docs in Ohio. Ohio is going to be the place hosting our National Optometric Association Convention for 2025. Hope that you guys have a great evening. And again, thank you for tuning in on Protecting the Vision, knowing when it's time to go see your optometrist. Have a great evening, and I'll see you on our next webinar.